Hi there. Come on in. And welcome to the firm. How are you today? That's great. Well, I'm one of the company doctors, and what we're going to do today is begin by taking your medical history. So, it's a quick questionnaire, just telling me all about your health in general and your health in the past. What we'll do then is we'll head through to the examination room, and I'd just like to do a few baseline tests so that going forward, if there are any problems or if you feel like something has changed, we've got those initial test results. Is that okay? Fantastic. So, we'll crack straight on with this medical history questionnaire, okay? It's about 4 or 5 pages, but it hopefully won't take too long. But by the end of it, you should be nice and relaxed and ready to start taking these medical tests, okay? Great. So, can I start by taking your full name, please? And your date of birth. Fantastic. Your marital status, please. And your last occupation before coming to join us. And what was the name of your doctor before you joined us? And do you remember the date of your last physical exam? If you don't remember the exact date, something rough would be great. Fantastic. So I'd like to start with childhood illnesses. Did you have any of the following? Measles, mumps, rubella, chickenpox, rheumatic fever, polio. Okay. And are you up to date with your tetanus shots? Have you ever had an immunisation for pneumonia? Immunisation for hepatitis A and B? Chickenpox? Influenza, the flu? Have you been vaccinated? MMR? Meningitis? Okay. Have you ever had an eye exam? Do you remember the date at all, or the rough date? Okay. Have you ever had any surgeries before? And if so, some brief details, please. Mm-hmm. And the name of the hospital that you've been under the care of before now. Okay. Other than for surgeries, have you ever been hospitalised before? And if so, what for? And which hospital? Mm-hmm. Have you ever had a blood transfusion? And then, if you could list for me any other physicians you've seen in the last 12 months and the reason for you seeing them. That can be anything from your doctor to an optician, physiotherapist, anything like that. Mm-hmm. Okay. That's great. That's the first page done. See, we're powering through. So we're now talking about your current medical history. So, have you ever had any of the following? It's a big list, so yeses and nos. I don't need any further details at this point. Anemia. Complications from anaesthetic, either local or general. Anxiety disorders. Arthritis. Asthma. Autoimmune. Any bladder problems at all? Any bleeding disease? Blood clots? Blood transfusion, we've done that one. Any kind of bowel disease? Colon cancer? Going alphabetically. Depression? Diabetes? Any growth or development disorder? Hearing impairment? Heart attack? Heart disease? Heart pain or angina? Hepatitis A, hepatitis B, hepatitis C. High blood pressure? High cholesterol? Hives? Any kind of allergies? Kidney disease? Liver disease? Any kind of lung or respiratory disease? Any mental illness at all? Migraines? Osteoporosis? Reflux? Indigestion? Seizures or convulsions? Severe allergies? Yeah, kind of stroke, brain event at all? Thyroid problems? Ulcers? Any visual impairments, including needing corrective lenses, glasses, contacts, anything like that? Any other disease or significant medical illness that I should know about? Anything that I haven't listed? So next, a list of any prescribed drugs or over-the-counter drugs. So anything that you've been prescribed by a doctor, anything that you buy regularly, so vitamins, things like that, and also include inhalers. And how often you take them, please. Okay. Any herbal remedies, anything like that? Okay. Any allergies to any medication? And if so, what kind of reaction did you have? Okay. Thinking of your family now, we're thinking of parents, grandparents, siblings, and any children. Has your family had any of the following? It's a slightly shorter list, so anemia, complications from anaesthetic, arthritis, asthma, bladder problems, bleeding disease, any kind of cancer, depression, diabetes, heart disease, high blood pressure, high cholesterol, kidney disease, any lung or respiratory disease, any migraines, osteoporosis, seizures or convulsions, any severe allergies, stroke or any brain issues, thyroid problems, mother, grandmother, sister developed heart disease before the age of 65, father, grandfather, brother, heart disease before the age of 55. Thank you very much. Very personal question, so thank you. All of this will, of course, be kept confidential. Your social history comes next. So, do you exercise? How many minutes per week would you say you exercise? Are you dieting? Number of meals you eat in a day? Thinking about your salt intake, is it high, medium, or low? Thinking about your fat intake, high, medium, low. Thinking about your caffeine intake. This is where I would go very wrong on one of these forms. My caffeine intake is very high. Coffee, tea, cola. How many cups, cans per day? Do you drink alcohol? What kind of alcohol do you drink, and how many per week? Do you use tobacco? How many cigarettes or packs per day? Sorry, is it cigarettes? Is it chew, a pipe, anything like that? Cigars? Previous user but has quit. They're your options. Okay. Do you currently use recreational or street drugs at all? Have you ever given yourself street drugs with a needle? Thinking about your mental health, because that's very, very important to us here. Is stress a major problem for you? Do you ever feel depressed? Do you panic when you're stressed? Do you feel the need to cry frequently? Do you have trouble sleeping? Have you ever been to see a counsellor? Thank you. Do you live alone? Do you fall over frequently? Any vision or hearing loss? How often do you have sun exposure? Do you like to go out in the sun? Do you sunbathe? Have you ever experienced sunburn? How often do you wear your seatbelt? Fantastic. Nearly there. Finally, do you have any advance directives? Do you have any religious or cultural beliefs that will affect your healthcare that I can help to help you? How do you best learn new information? If I gave it to you verbally, if I gave you written instructions, or if I gave you pictures? Your highest level of education, less than high school diploma, 1 to 4 years of college, or more than 4 years of college. Do you understand English well? It's a little bit late if you don't, isn't it? I ought to put that earlier in the questionnaire. Do you have a language that you prefer? Okay. I'd like you to think finally about your health right now. Okay, so do you have any symptoms that you're currently experiencing or have frequently experienced in the past? Any fever or chills? Feeling tired or fatigued? Eye pain or red eye? Any eyesight problems? Dry eyes, itchy eyes? Changes in vision? Earache or loss of hearing? Nosebleeds? Sore throat or hoarseness? Ringing in your ears? Sinus problems? Any chest pain or palpitations? Fast heartbeat, slow heartbeat? Cold hands or feet? I'm always cold. Any muscle pain? Any swelling in your legs? Shortness of breath or feeling wheezy? Any cough or shortness of breath with activity? Difficulty breathing while you're lying down or sleeping? Any abdominal pain? Any heartburn? Any muscle or joint pain? Any joint swelling or stiffness? Any limb pain, arms, legs? Any back pain? I think these days most of us have back pain from sitting too long, standing too long. Any itching? Any confusion? Any dizziness? Any limb weakness? Any difficulty walking? Any numbness or tingling? Any frequent falls? Sleep disturbances? Emotional problems? Easy bleeding or bruising? Any swollen glands at all? Fantastic. That is the end of the medical questionnaire. Okay, so I have everything I need here, which is great. So if you'd like to follow me through just the examination area, and what we'll do now is we'll do some baseline tests that will accompany these results. Okay, yep. Follow me. Okay, so time to get your breath back after answering all of those questions. How are you feeling, okay? Luckily, that is the only time you'll need to do that one, so that's good news. Nothing too taxing now, nothing that you'll have to think about, and certainly there won't be any more questions to answer. Okay, what I'm going to do is just take a look and get, as I say, some baseline results, so something to compare any future results to. And as you've said that you're feeling generally pretty fit and healthy, this will be a decent set of baseline results, okay? Fantastic. So, the first thing I would like to start with, I would like you to just put this on your finger, please. And this is going to measure the oxygen levels in your blood, okay? Get the right way. So, which finger? Okay. Okay. Just wait while that gives a beep to say that it's done. It won't take too long, and I can just record that one. Yep, there we go. So let's grab this back. That's great. Thank you. Excellent. I'd like to take your temperature next, please. It's with an old-fashioned thermometer. And this just goes under your tongue. Okay, so open wide. I was going to ask you a question then. That would have made no sense. I'll ask you a question shortly. Thank you. It's normal. Blood pressure next. Had your blood pressure taken before? Excellent. So while we do this then, tell me, what made you join this company? Oh, okay. I'm in here for me. Okay, let's plug you in. Right, you'll hear the machine next. That's great. We'll just let that deflate and then we'll take the reading. Well, lots of people who work here have been here for many, many years, and so I hope to be seeing you for many, many years too. It really is a fantastic place to work. That's great. Let's unplug you. Focus off. Slide that arm out for me. Thank you. Lovely blood pressure. Okay, great. Next, this might seem like a random order. Just like for you to identify a couple of things on my clipboard for me if possible. We're not going to do, it's part of a cognitive assessment, we're not going to do the full one. But there are some animals on here, and I'd just like you to identify them for me. Okay, so can you see okay? So, you tell me what this one is, please. And this one. And this one. That's great. Thank you very much. And then I'm going to read you a list of numbers, and I'd like you to read them back to me, and then I'm going to read them again, and I'd like you to read them backwards for me. Okay? So to begin with, if I say 1, 2, 3, you just need to reply 1, 2, 3. Okay? So 7, 4, 2. Good. 2, 1, 8, 5, 4. Fantastic. So this time I'm going to say the numbers and I'd like you to say them in reverse for me. So if I say 1, 2, 3, I'd like you to say 3, 2, 1. Okay? So here we go again. 7, 4, 2. That's right. 2, 4, 7. You've got it. 2, 1, 8, 5, 4. Great. That one is a little trickier, but that's fine. So next, would it be possible, I'd just like to have a feel of the glands in your neck, have a feel around some of those lymph nodes. Is that all right? Thank you. I'll just pop on some gloves. That's great. So you're in no pain there at the moment, no discomfort. And just sitting nice and still for me. Just look up slightly for me. Okay. Okay. That's great, thank you. That's great. Thank you very much. While I have my gloves on, would it be possible to just take a feel around your stomach quickly? That's fine, you don't need to do anything. You can do this over your clothes, that's fine. Okay, here we go. Just some light pressure, okay. Feeling okay? Yeah, that all feels good. Thank you. Okay. Take these off. What I'd like to do next is a little reflex testing. Just on your arms, using this, okay? It's not sharp, and we're not hitting hard, we're tapping gently, just enough to stimulate those reflexes. So, this arm first, if you can just hold out your arm for me. Okay? Just going to put my hand under your arm. Here we go. Okay. That's great. One more time. Fantastic. And then this arm for me. Same again. I'll put my hand under your arm. Here we go. That's great. Well done. Thank you. Pro reflexes. Well done. Okay. Next, what I'd like you to do, have you seen one of these before? That's great. What I'd like you to do is I'll hold on to it for you, and I would like you to blow into it as hard as you can. Okay? Don't do anything that would make you feel uncomfortable. Don't do anything that's painful. Okay. We'll do it 2 or 3 times, okay? So, ready? Big exhale. That's great. Yeah, that's good. Let's see. You can do it again. So, here we go. Big exhale for me. Thank you. They're much better. Good. Often we need a practice one to begin with. One more time for me. Okay, here we go. Big exhale for me. Fantastic. Very good. Well done. So starting to get a very good picture of your health now. Okay. I'd like to look at your eyes quickly. 2 things. Firstly, I'd just like to look to the back of your eyes with this light. And then I'd like you to just read a couple of lines from the eye chart for me. Is that okay? Great. So, I'd like you to just look forwards for me. And I'm going to look at this eye first. Okay? Here we go. That's great. Excellent. This side next, okay? Here we go. Fantastic. Just give it a good blink before we read this, because that light is very bright. Okay. So, here we go. All I need you to do, let's say the top 1, 2, 3, 4 lines for me, please. When you're ready. That's great. Well done. Okay, good. What I'd like to do next is just take a listen to your chest, if possible. Yep. What we'll do another time is we'll have you back for a proper EKG, but for now, this will be a decent baseline. That's great. So, it's going to listen once either side. Okay. So, nice deep breaths for me. Okay, here we go. So, deep breath in for me. And out. Deep breath in. And out. It's fantastic. Again on this side, okay? Same again. Here we go. So, deep breath in for me, and out. Deep breath in for me, and out. Fantastic. Everything's sounding lovely, nice and strong. Do you have any questions for me? Okay. Well, what will happen next is some sort of machine-based tests. So we'd like to do an EKG, we'd like to do some scans as well, check everything is in absolutely perfect health, and we'll also take some bloods at the same time, which we'll send off to the lab. But for now, I have everything I need for this initial health assessment. So, thank you for bearing with me through the huge questionnaire. I really appreciate it. And thank you for giving me all of these numbers for the baseline tests. The important thing to remember is that now you work for the company, we are here for you whenever you should need us, okay? So if there's any problem, no matter how minor, then please do get in touch. You know where to find us. We are a large team here, so there will always be somebody available to you. So the important thing is, do not suffer in silence, okay? There is always somebody to help you, okay? Fantastic. Well, that's us done for now. We'll give you a call shortly and let you know when to come back in for those bigger tests. But in the meantime, it was lovely to meet you once again. Welcome to the firm, and I will see you again very soon. Take care of yourself.